All right, I want to give some credit to my guest here, Dr. Regan Ackerman, because Dr. Ackerman, thanks to you, every time I eat something that I enjoy that's crunchy, like almonds or carrots or apples, I think of Freedom Mini Dental Implants.
And you don't take it for advantage, don't take it for granted.
I don't take it for granted, because you were telling me there's people who can't eat the foods they enjoy because they have ill-fitting dentures. And you're saying you can fix that.
Yes.
And it's good news, folks. Again, Freedom Mini Dental Implants. So, in a nutshell, for those who've never seen you on the station, tell them exactly what you do and the reasons why there are advantages over the old method.
Yes. So the biggest thing I do is people that are wearing dentures, get them out of denture glue, get them eating better. And we use mini implants. It's a smaller size diameter. So it's a lot less invasive, less healing time, no stitches, no surgery, no bone grafts, no gum grafts, anything like that. And it's usually a lot less expensive than the big surgical implants, anywhere from a third to half the cost of the surgical implants. So like I said, a lot of what we do is get people out of regular dentures so they're not using denture glue, or get rid of the denture completely. We also replace, one tooth, 2 or 3 teeth. So there's a variety of ways we can use the mini dental implant.
Yeah, so let's go over the checklist here. Okay, so first of all, it's less invasive.
Less invasive.
Okay, no surgeries.
No surgeries, no incisions or stitches.
You don't have to be sedated.
Nope, no.
Okay,
no
I'm liking this.
Yep, just local anesthesia. You're awake, but I'm not making any incisions or stitches. I know we'll show the model later, but just a little, numb up the gum, a little hole through the gum, and when you leave, you're not bleeding or swelling or anything like that, like the old surgical method.
And here's the really good news: everyone's on a budget. It's less costly. It's less costly. So if you're worried about expense, if you're thinking you have to go through all these surgeries, it checks off every good thing that can possibly happen with your smile. Okay, so before we get into today's example, and I love the before and after pictures, because I think then it comes to life. But if you would, you have a couple of methods, right?
Yes.
So show me there's 2 main methods, right? The way you do this.
As far as if you're, missing all your teeth or have to have all your teeth removed, there are 2 main methods. One is the snap-in denture. So it's still a denture, but you get rid of the denture glue and your denture stays in a lot better. Everybody always complains about that lower denture just flopping around. A lot of people don't even wear it because it won't stay in. So that's where the snap-in denture comes in. And then the other option we do is the permanent teeth, where we just use more implants, but you get rid of the denture completely, and those teeth are cemented permanently onto those implants so they don't come in and out. And they're the most like your natural teeth because you no longer have all the plastic of a denture.
Yep, and we'll show you the models a little bit later to explain it a little bit better. But all right, Diane is today's patient, right? And Diane, you become friends with these people. I see you smile when you start talking about people. Yeah.
She is near and dear to my heart. Diane came to me knowing she needed all her teeth taken out, but definitely wanted a better option than regular dentures. And she had a family member that was a patient of mine and highly recommended she come see me. And so, Diane and I kind of became friends. And so, so she came to us knowing she needed, the rest of her teeth taken out. So this is her before picture. And then she ended up doing the snap-in dentures. And I mean, just beautiful,
wow.
Beautiful, and
20 years younger.
Just exudes, confidence and smiling, and it was just amazing to see kind of her transformation and the confidence, and given her. And I know we always talk about the aesthetics, but just the functionality, able to eat again, chew again, bite into a cracker, things like that. So, but you can just see, the difference it makes in people's lives.
Yeah, because I've been to dinner with a dental wearer, and they have a very small portion of that menu that they can actually order from. Because anything that you have to chew, whether it be a really good juicy steak or, like you said, vegetables or fruits that crunch, they have to avoid that. And it's sad because
the snap-in dentures, yes, and the permanent teeth. That is why when you go out to eat anymore, or when you're talking about the denture flopping around, you don't have to apply denture glue every 4 or 5 times a day and carry around a big tube of denture glue in your pocket like many of my patients come in doing. So yes.
So you mentioned Diane, and you said that Diane had the snap-in denture, correct?
Yes.
Okay, so if you don't mind, show me that model for the snap-in denture.
Certainly. So this is a very common procedure we do. We call it the snap-in denture. So, imagine this is your mouth without teeth here. Let me get centered. There we go. So, imagine this is your mouth without teeth. And the way these implants are placed, I just numb you up with a little, put you to sleep, no sedation, make a tiny little hole through the gum, torque down into the bone. The nice thing about the mini implant, you don't have to wait another 3 to 6 months for these to heal. The same day your denture, and then that same day you will leave with your denture snapped on to those implants. So then your denture glue, it's a lot more stable. You'll wear this denture pretty much 24/7, but you'll snap it out once a day and be able to rinse and clean it, and then you just snap it right back in, no glue. You can eat better, chew steak again, all those good things you want to eat again. It's dramatically better than just having regular dentures. So this is the snap-in denture option.
Okay. Now, permanent teeth.
Yes.
Okay, you call it your third set of teeth.
Yes, it's like is the best option because you can get rid of the denture completely. So as you can see, then there's no more plastic. It's a lot stronger than a denture, which is why they can just be the teeth. So when we place the implants, we're going to place them the exact same way. We're just going to place more implants. So no incisions, no stitches, just a little numbing. Place these implants, and then these teeth get cemented permanently onto the implants. So they know nothing comes in and out. This is, like you said, closest thing to getting your natural teeth back. But then you have nothing on the roof of your mouth anymore, no plastic. You get to taste your food again. And your job, you're going to brush them at home and we keep them clean, and you get them cleaned every 6 months just like you would your normal teeth. These teeth are cemented on, no movement. You can eat, chew, just about.
And saying, I can live with these dentures. I don't look my best. I can't eat the foods I love, but I can live with it. I think this is great because the pushback of the old method, before you're saying, well, I don't like being,
much bone, I just need some bone because it's a smaller diameter. You weren't a candidate for implants before. It may be that you weren't a candidate for the bigger surgical implants, but you can be a candidate for the mini implant because I don't have to have as much bone. A lot of times I can place implants in areas where you might have been told you had to have a sinus lift or a bone graft or something.
All right, if you have a question, if you're wondering, are you a candidate? Do you have a loved one who would like to throw away their dentures? Maybe you have a tooth here or there that is missing. We can take care of you too with Freedom Mini Dental Implants. 571 after these with Freedom Mini Dental Implants.
Has your loved one been abused in a nursing home? Bed sores, broken bones, dehydration, and malnutrition are all.
Our associates and the customer.
Toyota of Louisville was started on Dixie Highway, but we outgrew it, so we moved to this location, 6514 Dixie.
It's going to be at the forefront of what we do.
We believe in fair and honest dealings.
I think that speaks volumes.
Toyota of Louisville, we have always been and always will be a Swope dealership where nobody walks away.
Hey, it's Deanne Stevens. I'm here with Ins Inside. Lisa, what does that mean?
Well, we pride ourselves on changing the body chemistry inside so that you can actually you're able to get out and do those things with your kids or your grandkids. As you start to age, you start to lose those vital hormones. And it's like not putting gas in your car. You need some gas. That's what'll get you going.
30 pounds in 30 days. Can we really do that?
I can't tell you how many times I've seen that in the past 10 years.
How does it work? What do? We start off
lab work, a physical, and for the first 20 callers, we also
at 25again.com.
Call. Let's give hope.
We talked a lot about the enjoyment of foods that you love. Let's talk after. We've got a lot of weddings going on right now, family events, that kind of thing. Everyone hopefully will continue to be able to gather and take pictures. But with that being said, how often do you hear a patient say, I'm tired of covering my mouth when I smile, or I try to stay out of pictures, or I refuse to go out. You hear that?
I hear that all the time. Especially they avoid social gatherings or going out to eat, or they're invited to dinner and gatherings, but they're like, it's not even worth me going because dentures could hardly wear them. And he was going through job interviews, and we were able to do the snap-in dentures for him, and he went to his next job. Worry about his dentures flopping around or clicking because they were moving. So
it's not only really to make you feel better in your self-esteem, but I agree with a job interview. If you had a fear of, he's going to notice that I'm talking funny, I'm not confident, and being able to really show your best self.
For sure.
So it's just interesting. For those out there, you may be saying, well, I've been told before with the old surgical method that about why you need less bone, or how much less bone you need.
Kind of hard to see. They're probably gonna have to zoom in pretty close to see the little hole it makes. So the big hole that you can see pretty good, that's the hole they make for the big surgical implants. That's how much bone they need. So when I place the mini implant, that is my little, have to have much bone at all. I just have to have some bone to be able to place. This really shows you, if you were told you had to have a bone graft or didn't have enough bone before, you may be a candidate for the mini implants. Hopefully now you do, and just call the office. It's a free, and see that you have enough bone for the mini implant, and you can see that's just my little pilot hole that I have to make versus the big surgical method.
Well, we had a call from someone who they said, look, I've been told I'm not able to get these implants. True or false?
So I do not have to take people off blood thinners to place the mini implant. Versus that, a lot of times they have to be taken off their blood thinner, or certain things have to be checked. But majority of the time, I do not have to take patients off blood thinners, and that's why they lost all their teeth. So they were told they may not be a good candidate for the surgical implants, but you can definitely be a candidate for the mini implants. Even if you are diabetic or you've been told that a lot of your medical history, we don't have to,
Okay, so maybe your son was in a baseball game, you were in a car accident and you lost a few of your teeth. Okay, you can help, right?
Yes. Just like you said, if you had trauma and you are missing, even people that have partials, those come in and out, they're cumbersome, nobody likes those. We can replace teeth. So it doesn't have to be just dent, but definitely, so many people out there are wearing what we call a flipper, or like a temporary partial, and if you're wearing it, you know it and you hate it and you want to get rid of it, please call. Like I said, the consult, good candidate for the mini implant. We'll go over cost, how this all works. It's no charge, so all you have to do is call and make the appointment.
Free consultation, that works. Okay, so I'm curious, just a question from a medical standpoint. Diane, who is our patient today, and if we could show her before and after, she looks fantastic. You mentioned that she was referred by another family member.
Yes.
Is that something that's common? Because I would think that challenges with teeth issues may run in a family, may be genetic.
And honestly, that's the biggest compliment I can get is,
Sure.
When I know a patient, they were pleased with their treatment. So yeah, we get a lot of referrals.
Okay, when I think less invasive, translation, less pain.
Yeah.
Numbing of the gums is what you've told me, right?
Yes,
Right.
yeah, just it's local anesthetic. I don't do sedation. So yeah, I've had people that we've replaced this. They maybe took an ibuprofen and that's it. They went to work the next day, had some more implants. The first 24 hours, I always tell people it's going to be a little achy, less painful than the surgical method and stitches and being in pain, for up to a week or longer.
All right, and the consultation is absolutely free. So again, if you have a question, 571-5263, are you a candidate? I'm betting you are, and that's your answer. If you're on a good news for you, and if you want a really confident smile, a beautiful smile, dental implants. We'll be right back with Dr. Regan Ackerman and your calls.
I'm attorney Jim Desmond, and for over 20 years, I've only handled car and motorcycle accident cases. Winning these cases through the years, I've been hyper-focused on this area of the law for a free consultation.
In the midst of hate, be the reason someone smiles today.
The best Detroit-style pizza comes from by Jets, because nothing tops our hand-pressed dough. Thick, golden crunch. So go ahead, order a one-topping 8-corner pizza for $11.99. Jets.
When it comes to blankets, sit firm.
Dr. Ackerman, before I had conversations with you, I previously thought they have things called flippers.
Yes.
Does it make them go,
No, it does not. They probably feel like it does, though, because when you try to talk with it.
I'm not old enough to remember flipper.
I know
I want to say that.
I know it.
Yeah. If you have a flipper in your backyard, that's a big pool.
Yeah.
If you would show us that.
Replace just a single tooth. So, what we call congenitally missing or genetically missing some front teeth, single tooth. place the implant the exact same way, no incision, implant in, you will leave with a temporary tooth on there. So you get rid of bearing to replace it. So the temporary tooth goes on that day, which is a nice thing. And then you don't have to wait another 3 to 6. You'll come back about 4 to 5 weeks later. We'll have the nice, pretty porcelain tooth. We'll try everything in, it looks good. It gets cemented, and then you no longer have that little temporary partial or that flipper. Really cumbersome to wear, and they move around, and they're hard to eat. So that's how we do one tooth. And then this model can also show you, if a lot of people are missing their back teeth, their molar teeth, your big chewers, and then we make what we call a little bridge of teeth. The teeth are connected, but then you have something to chew with again, fill out your smile, missing all their teeth. We can replace one tooth, we can replace 2 or 3.
We had a unique call from a viewer, and she did not want to go on there, but she said that because of her ill-fitting dentures, her gums were really irritated. And I would think because this is not that invasive, you could, how would you?
Sore and raw because that denture's flopping around, it doesn't move. Like she said, it's ill-fitting. So we may have to make a new denture that fits better, first of all, but then once we place the implants, either the snap-in denture, when we do the snap-in denture, that denture's not going to flop around and move, so it cannot rub on your gums anymore. And then with the permanent teeth, you get rid of the denture completely, so nothing can rub on your gums anymore. So that is a great question. That is the whole reason you do mini implants. If you have a denture that's flopping around, move implants to stabilize the denture or get rid of the denture completely.
Dr. Ackerman, when you come on the show, I love, as I've mentioned before, the before and after pictures. Really, going to social functions, eating the foods that they love. But I want to hear someone that a patient out. I want to say friend because they become that. Yes. What do they tell you? What do they say?
Everyone's situation is different. Confidence, and a lot of people just want to eat again and eat, all those good foods. But yeah, a lot of people come to me that have tried everything with their dentures or were told they weren't a candidate for implants. I know a specific patient near and dear to my heart. I think we all cried when we cemented his permanent teeth on and he came back and he was like, "You have changed my life," because he didn't think he had anything that thought they didn't have any options. So that is why I always say, please just come in for the consult, see how this all works, because so many people think they don't have any options left, and there could still be an option for you with the mini implant.
Yep, and the consultation's free. Amber was nice enough to watch and to call. Amber, welcome to the show. You have a question for Dr. Ackerman?
Hi, yes I do.
Hi.
So my question is about probably 14 years ago or so, I got a root canal and then a cap put on.
Mm-hmm.
And then a few years later, I got braces, and there was a lot of crowding, but there was movement. Everything was fine. But I've read a lot of scary things about root canals and what, like, those hidden germs and implant. Is that something that you would do?
That's a good question. The only reason that tooth has had a root canal essentially just takes the nerve out of your tooth so that you no longer can feel pain from that tooth. So I'll be honest with you, if that root canal is good and you're not having any problems with it, there's no reason to remove that tooth. And needed to be removed, then yes. The root canal is kind of part of the tooth. So you would have the tooth removed and then we would place the...
Before we go, I want to bring this up. Some people are embarrassed and you can take care of your teeth, you can floss and brush, and it's just genetic, and it's maybe the hand you were dealt.
Yes.
So the embarrassment needs to be taken out of the equation.
No, yeah. And I see people all the time that have spent, thousands of dollars trying to save their teeth. They have gone to the dentist religiously. They have done everything they can, and unfortunately, it just comes down, that also, yes, our office is a judgment-free zone. There are many reasons why people can lose their teeth, not just because of lack of care.
Yep. And the consultation, Wave Country with Don G. We'll be right back.